Hi, this is Ben. Let's talk about the glomerular filtration rate. The glomerular filtration rate, or GFR, is the amount of plasma that is filtered through the glomerulus per unit time. Specifically, it can be measured using the clearance of inulin. Inulin can be used in this way because it is freely filtered and neither reabsorbed nor secreted. This means that the volume of plasma cleared of inulin is equal to the amount of plasma filtered through the glomerulus per unit time. Remember also that inulin can be used to measure extracellular volume. One additional high-yield point just to keep in mind. In clinical practice, creatinine clearance is frequently used because it's easier to measure, but it also slightly overestimates GFR. This is because renal tubules secrete creatinine to a small extent. GFR is used as a proxy to measure kidney function, and ultimately depends on the Starling forces present at the level of the glomerular capillaries. In this equation that you see here, Kf is the filtration coefficient, a constant. It is dependent upon the resistance to fluid flow through the filtration barrier of the glomerulus. A higher Kf correlates with a higher GFR, and thus less resistance. What is something that could lower Kf? Or, asked another way, what could increase resistance to fluid flow? One example is damage to the glomerulus resulting in scarring and decreased permeability of the GBM. Overall, a lower Kf correlates with a lower GFR. If you look at this equation, you will notice that it essentially deals with two different pressure gradients, an oncotic pressure gradient and a hydrostatic pressure gradient. The oncotic pressure gradient can be thought of as a combination of osmotic type forces that pull fluid into a space. The hydrostatic pressure gradient can be thought of as a combination of pressure type forces that push fluid away from a space. Let's draw a quick picture to see how this all works. I'm drawing the glomerular capillary on the left and Bowman's space on the right. What you see in the middle here is actually the filtration barrier. PGC is the hydrostatic pressure within the glomerular capillary, and it will encourage fluid filtration. PIBS is the oncotic pressure of the Bowman's space, and it will also encourage fluid filtration. PBS is the hydrostatic pressure of Bowman's space, and it will oppose filtration. And PIGC is the oncotic pressure of the glomerular capillary, and it will also oppose filtration. What you see on top are the two different hydrostatic pressure gradients pushing fluid away, and what you see on the bottom are the osmotic pressures pulling fluid. Now that we understand that a little bit better, let's move on to a flash quiz. Time for a flash quiz. Calculate the GFR in milliliters per minute for a patient using the following values for inulin. A urine concentration of 100 milligrams per deciliter, a urine flow rate of 120 milliliters per hour, and a plasma concentration of 2 milligrams per deciliter. Answer: 100 milliliters per minute. Let's quickly work through this so we can see how we arrive at this answer. Remember, the GFR is equal to the inulin clearance, which equals the urine concentration of inulin times the urine flow rate all over the plasma concentration of inulin. And plugging in our numbers, we get the following. Canceling a few numbers, and this comes out to be 6,000 milliliters per hour. But remember, the question asks us for milliliters per minute in terms of units. So we'll have to calculate this by converting from hours to minutes. You can do this by simply dividing by 60. And we come up with our answer of 100 milliliters per minute. A GFR around 100 milliliters per minute would be expected in a young, healthy individual, but this number will continue to decline as the patient ages. A GFR decline below 60 milliliters per minute corresponds with moderate to severe kidney disease. And as the GFR decreases below 15 milliliters per minute, this is actually technically defined as kidney failure. Time for another flash quiz. If the same patient has the following concentration for sodium, with a urine sodium of 70 milliequivalents per liter, a urine flow rate of 100 milliliters per hour, and a plasma sodium of 140 milliequivalents per liter, does this patient have net sodium reabsorption or net sodium secretion? Answer: net reabsorption of sodium. Using the following formula for clearance, and plugging in our numbers, and canceling some numbers, we end up with 50 milliliters per hour. But remember, we want to convert this to milliliters per minute, so we need to divide by 60. And this comes to 0.82 milliliters per minute. Because this is less than the GFR of 100 milliliters per minute as we previously calculated, this means there is net reabsorption of sodium. Be comfortable with these equations because the USMLE will test your knowledge of both of them conceptually and mathematically.